Do you ever wake up in the middle of the night with a mouth that feels as dry as a desert? That sticky, uncomfortable feeling where your tongue feels glued to the roof of your mouth, and you find yourself desperately reaching for a glass of water on your nightstand. It's a feeling that can be more than just annoying. It can be distressing, disrupting your precious sleep, and leaving you feeling parched and groggy in the morning. Maybe you find it difficult to speak clearly first thing, or you notice your throat is scratchy and sore. You might even find that foods just don't taste the same as they used to, or that chewing and swallowing have become a chore. If any of this sounds familiar, please know you are far from alone. This condition, often called dry mouth, is incredibly common, especially as we get older. It's a shared experience for millions, yet it's something we often suffer through in silence, thinking it's just another unavoidable part of aging. But what if I told you it doesn't have to be? What if there were simple, effective ways to manage that dryness, to soothe the discomfort, and to get back to enjoying a restful night's sleep and a more comfortable day? Before we dive deep into the causes and, more importantly, the solutions for nighttime dry mouth, if you find this kind of health information helpful, please take a moment to support our channel. Go ahead and click that thumbs up like button. Subscribe to the channel so you don't miss our future videos, and be sure to click that little bell icon. When you click the bell, you'll be notified every time we release a new video designed to help you live a healthier, more comfortable life. Your support helps us reach and help more seniors just like you. Thank you. All right, let's get into it. The medical term for dry mouth is xerostomia. It sounds complicated, but it simply means your salivary glands aren't producing enough saliva to keep your mouth moist. Now you might be thinking, it's just a little dryness, what's the big deal? But saliva is one of our body's unsung heroes. It does so much more than just keep our mouths wet. Saliva is absolutely essential for our oral health and our overall well-being. First, it helps us digest our food. It contains enzymes that begin the process of breaking down food right in your mouth, making it easier for your stomach to do its job. Second, saliva allows us to taste. It dissolves the tiny particles in our food so that the taste buds on our tongue can actually detect flavors like sweet, sour, salty, and bitter. Without enough saliva, food can taste bland or just plain strange. Third, it acts as a natural lubricant, allowing us to chew and swallow safely and comfortably. When your mouth is dry, food can feel stuck, and swallowing can become difficult or even painful. This can sometimes lead to poor nutrition if eating becomes too much of a challenge. Fourth, and this is critically important, saliva is your mouth's first line of defense against tooth decay and infections. It constantly rinses away food particles and debris from your teeth and gums. It also contains minerals like calcium and phosphate that help to remineralize and strengthen your tooth enamel. Furthermore, it neutralizes the harmful acids produced by bacteria in your mouth after you eat. Without a healthy flow of saliva, these acids can eat away at your enamel, leading to a much higher risk of cavities. A dry environment also allows harmful bacteria and fungi to thrive, which can lead to gum disease, mouth sores, and a common fungal infection called oral thrush, which often appears as white patches in the mouth. Finally, saliva makes it possible for us to speak clearly. It lubricates our tongue, lips, and cheeks, allowing for smooth and easy articulation. So, as you can see, a lack of saliva is much more than a minor inconvenience. It's a health issue that deserves our attention. So the big question is, why does this happen, and why does it seem to get so much worse at night? There isn't just one single answer. It's often a combination of factors, many of which are very common in our senior years. Let's break down the most frequent causes. The number one culprit by a long shot is medication. As we age, we're more likely to be taking one or more prescription or over-the-counter medications for various health conditions. And hundreds upon hundreds of common drugs list dry mouth as a primary side effect. It's one of the most common side effects reported for any medication. Let's look at some of the major categories. Medications for high blood pressure, like diuretics or water pills, are a big one. They work by helping your body get rid of excess salt and water, but in doing so, they can dehydrate your entire system, including your salivary glands. Antihistamines, which many people take for allergies, and decongestants found in cold and sinus remedies, are designed to dry up mucus, but they don't just target your nose. They dry up your mouth and eyes too. Many medications used to treat depression, anxiety, and other mental health conditions also have this effect. Pain relievers, especially certain powerful prescription painkillers, can reduce saliva flow. Muscle relaxants and medications for an overactive bladder are also well known for causing significant dry mouth. The list goes on and on. If you're taking multiple medications, the effect can be compounded, meaning the dryness can be even more severe. It is absolutely crucial to state here, please do not stop taking any of your prescribed medications just because you suspect they are causing dry mouth. These medications are important for your health. The key is to talk to your doctor or pharmacist. They need to know about this side effect. Sometimes they might be able to adjust the dosage, switch you to a different medication that doesn't have the same side effect, or suggest a different timing for your dose that might lessen the impact at night. Beyond medications, the natural aging process itself can play a role. While aging doesn't automatically cause dry mouth, some studies suggest that our salivary glands may become slightly less effective over time. Our body composition changes, and our ability to conserve water might decrease, making us more susceptible to dehydration, which directly leads to a drier mouth. Another major category of causes is underlying health conditions. Certain diseases are directly linked to xerostomia. One of the most well-known is Sjogren's syndrome. This is an autoimmune disorder where the body's immune system mistakenly attacks its own moisture-producing glands, primarily the salivary glands in the mouth and the tear glands in the eyes. This results in chronic, severe dry mouth and dry eyes. Diabetes is another common condition that can lead to dry mouth. High blood sugar levels can cause frequent urination, leading to dehydration. Furthermore, uncontrolled diabetes can affect the nerves that control the salivary glands. Other conditions like Alzheimer's disease, Parkinson's disease, and damage from a stroke can interfere with the brain's ability to send the correct signals to the salivary glands to produce saliva. Even something as simple as a yeast infection in the mouth or thrush can be associated with a sensation of dryness. For some individuals, cancer treatments can be a significant cause. Radiation therapy, especially when directed at the head and neck area to treat cancers, can cause severe and sometimes permanent damage to the salivary glands. Chemotherapy, which affects cells all over the body, can also change the consistency and amount of saliva you produce, leading to a very dry, uncomfortable mouth during treatment. Nerve damage can also be a factor. Any injury, trauma, or surgery to the head or neck area that damages the nerves responsible for signaling your salivary glands can impair their function, resulting in reduced saliva flow. Finally, we have lifestyle factors. These are the habits and choices we make every day that can contribute to or worsen a dry mouth, especially at night. One of the simplest and most common factors is breathing through your mouth instead of your nose while you sleep. When you breathe through your mouth, the constant flow of air over your oral tissues acts like a fan, rapidly evaporating any moisture that's there. Why might you be a mouth breather at night? It could be due to nasal congestion from allergies or a cold. It could be due to a deviated septum or nasal polyps. It could also be a sign of a more serious condition called sleep apnea, where you repeatedly stop and start breathing during sleep, often forcing you to gasp for air through your mouth. If you snore heavily and wake up feeling exhausted no matter how long you've slept, it's worth discussing the possibility of sleep apnea with your doctor. What we drink also matters. Consuming beverages with caffeine, like coffee, tea, and many sodas, especially later in the day, can have a diuretic effect and contribute to dehydration. Alcohol is even more dehydrating and can significantly worsen nighttime dry mouth. Using tobacco products, whether smoking or chewing, is notoriously bad for oral health and is a major contributor to dry mouth by reducing saliva production. And of course, the most basic cause is simply not drinking enough water throughout the day. Dehydration is a leading and thankfully reversible cause of dry mouth. So, with all these potential causes, it's no wonder so many of us are affected. But understanding the why is only the first step. The most important part is learning what we can do about it. How can we find relief and reclaim our comfort? Let's move on to the practical solutions, starting with simple home remedies and lifestyle changes you can start implementing tonight. The first and most fundamental step is to focus on hydration. This might sound obvious, but its importance cannot be overstated. You need to be sipping water consistently throughout the entire day, not just when you feel thirsty. Thirst is actually a sign that you are already on your way to being dehydrated. Try carrying a water bottle with you as a constant reminder. In the evening, make it a point to drink a glass of water an hour or so before bed. And most importantly, keep a glass or a thermal bottle of water on your nightstand within easy reach. When you wake up with that dry, sticky feeling, you can take a small sip, swish it around your mouth to moisten everything, and then swallow. This provides immediate relief. Avoid ice-cold water, as it can be a bit of a shock to the system in the middle of the night. Cool or room temperature water is often best. Next, let's talk about stimulating your own saliva production. Your body is designed to make saliva, and we can give it a little encouragement. Chewing is a powerful natural stimulant. During the day, try chewing sugar-free gum. Look for gums that contain xylitol. Xylitol is a natural sugar substitute that has been shown to not only stimulate saliva, but also to help prevent cavities by inhibiting the growth of harmful oral bacteria. Sucking on sugar-free hard candies or mints can also work wonders. Again, look for ones containing xylitol. Citrus flavors like lemon or orange are particularly good at getting your saliva flowing. Just be sure to choose sugar-free options, as sucking on sugary candy will dramatically increase your risk for tooth decay, especially with a dry mouth. Consider modifying your diet, especially in the evening. Try to avoid foods that are very dry, salty, spicy, or acidic right before bed. Salty foods can pull water from your system and make you feel more parched. Spicy and acidic foods can be irritating to a dry, sensitive mouth. Instead, opt for moist foods. Think about soups, stews, or adding sauces and gravies to your meals. Eating things that require a good amount of chewing, like crisp vegetables such as celery or carrots, can also help get your saliva glands working. The environment in your bedroom plays a huge role. A dry room will lead to a dry mouth. Using a cool mist humidifier in your bedroom at night can make a world of difference. A humidifier adds moisture to the air, which means the air you're breathing is less likely to dry out your mouth and nasal passages while you sleep. It can be one of the single most effective changes you make for nighttime relief. Be sure to clean your humidifier regularly according to the manufacturer's instructions to prevent the growth of mold or bacteria. Pay close attention to your oral hygiene routine, but with a few adjustments for a dry mouth. Continue to brush your teeth twice a day with a fluoride toothpaste, but consider using a toothpaste specifically formulated for dry mouth. These are often gentler and less irritating. It is crucial to avoid mouthwashes that contain alcohol. Alcohol is a drying agent and will only make your dry mouth worse. It might give you a temporary feeling of clean, but it strips away moisture. Look for alcohol-free mouthwashes, especially those designed to moisturize and soothe oral tissues. Many of these also contain beneficial ingredients like xylitol. If you suspect you're breathing through your mouth at night due to nasal congestion, address the root cause. You can try over-the-counter saline nasal sprays to help moisturize your nasal passages and clear out mucus before bed. Some people find that adhesive nasal strips, which you wear over the bridge of your nose, can help to open up the nasal passages and make breathing through your nose easier. Now, let's talk about the products you can find at your local pharmacy that are specifically designed to provide relief. These are often called saliva substitutes or oral moisturizers. This is where we get into the relief sprays, gels, and rinses that you may have seen advertised. These products can be a true lifesaver, especially for providing comfort through the night. Let's start with dry mouth relief sprays. These are incredibly convenient. They come in small portable spray bottles that you can keep on your nightstand or even in your pocket during the day. You simply spray a few pumps directly into your mouth whenever you feel dry. These sprays work by coating the tissues of your mouth with a moisturizing film that mimics natural saliva. They often contain ingredients like carboxymethylcellulose or hydroxyethylcellulose, which are thickening agents that help the moisture cling to your mouth surfaces. Many also contain glycerin, which helps to lubricate, and as we've mentioned, xylitol, which provides sweetness, stimulates saliva, and fights cavities. Using a spray right before you go to sleep, and again if you wake up during the night, can provide significant immediate comfort. For longer-lasting relief, especially overnight, you might want to consider an oral moisturizing gel. These gels are thicker in consistency than the sprays. You typically apply a small amount, about a half-inch strip, directly to your tongue, gums, and the roof of your mouth, using a clean finger or a cotton swab right before you go to sleep. The thick gel forms a protective lubricating film that lasts for several hours, helping to keep your mouth moist while you sleep. Many people find that using a gel at bedtime is the key to finally sleeping through the night without being woken up by severe dryness. Again, look for products containing ingredients like xylitol and soothing components like aloe vera. There are also moisturizing mouth rinses. These are different from your standard antiseptic mouthwash. You use them just like a regular mouthwash, swishing for about 30 seconds before spitting it out, but they are formulated to lubricate and hydrate rather than to just kill germs. Using one of these rinses as the very last step in your bedtime routine after brushing can create a moist environment in your mouth that helps you get to sleep comfortably. For those who wear dentures, dry mouth can be a particularly vexing problem. Without enough saliva, dentures can rub against your gums, causing painful sores and irritation. It can also make it difficult to get a secure fit, causing them to slip. All the remedies we've discussed can help. Keeping your mouth moist with sprays or gels will make wearing dentures much more comfortable. It's also vital to take your dentures out at night and to clean them thoroughly, allowing your gums to rest and breathe. So we have lifestyle changes, and we have over-the-counter products. But what if you've tried all of these things and you're still struggling? This is when it's time to have a serious conversation with your healthcare providers. Your dentist and your doctor are your partners in managing this condition. Schedule an appointment with your dentist. A dentist can assess the health of your teeth and gums and check for any complications from dry mouth, like cavities or signs of thrush. They can recommend specific products that they've seen work well for their other patients. They can also apply topical fluoride treatments, like a varnish or gel, in the office to give your teeth extra protection against decay. In some cases, they can even create custom-fit trays for you to wear at home with a prescription-strength fluoride gel. It is also essential to talk to your primary care doctor. As we discussed, your doctor needs to know that you're experiencing this side effect. Bring a complete list of all the medications you take, including prescriptions, over-the-counter drugs, vitamins, and herbal supplements. Seeing it all written down can help your doctor identify the most likely culprit or culprits. They might be able to change your prescription to a different drug that is less likely to cause dry mouth. For example, there are many different types of blood pressure medications, and some have a much lower incidence of this side effect than others. They might be able to adjust the dose or the timing. Never make these changes on your own. This must be done under your doctor's supervision. Your doctor can also run tests to see if your dry mouth is being caused by an undiagnosed underlying medical condition like Sjögren's syndrome or diabetes. Getting a proper diagnosis and treatment for the root cause is the most effective long-term strategy. If your dry mouth is severe and is not responding to other treatments, your doctor may be able to prescribe medications that are specifically designed to stimulate saliva production. There are two main prescription drugs used for this: pilocarpine and cevimeline. These medications work by stimulating the nerves that control your salivary glands, telling them to produce more saliva. They can be very effective, but they also have their own side effects and are not suitable for everyone, so it's a decision to be made carefully with your doctor. Let's try to put this all together into a simple action plan. A step-by-step approach to tackling nighttime dry mouth. Step 1. Hydrate and humidify. This is your foundation. Start carrying a water bottle. Keep water on your nightstand. And seriously consider getting a humidifier for your bedroom. This is the low-hanging fruit, the easiest and often most effective first step. Step 2. Stimulate and soothe. During the day, chew sugar-free gum with xylitol or suck on sugar-free candies. At night, try an over-the-counter solution. Start with a spray for its convenience. If you need longer-lasting relief, move on to a moisturizing gel applied right at bedtime. Step 3. Review your habits. Take an honest look at your diet and daily routines. Are you drinking a lot of coffee or alcohol in the evening? Could you switch to decaf or herbal tea? Are you a smoker? This might be another powerful reason to seek help in quitting. Are you using an alcohol-based mouthwash? Swap it for an alcohol-free, moisturizing one immediately. Step 4. Manage your breathing. Pay attention to whether you're breathing through your nose or your mouth. If you have congestion, try a saline nasal spray or a nasal strip. If you snore heavily and are always tired, talk to your doctor about a sleep study to rule out sleep apnea. Step 5. Consult the professionals. If these steps aren't providing enough relief, it's time to call in the experts. Make an appointment with your dentist to protect your oral health and get product recommendations. Make an appointment with your doctor to review your medications and investigate any potential underlying health conditions. This step is not a last resort. It's a crucial part of a comprehensive management plan. Living with dry mouth at night can feel isolating and frustrating. It interrupts your sleep, affects your comfort, and can have a real impact on your health. But I hope that after listening today, you feel a sense of empowerment. You are not helpless against this condition. There are so many things you can do, starting this very evening, to find relief. It might take a little bit of trial and error to find the combination of strategies that works best for you, whether it's a simple humidifier, a specific brand of moisturizing gel, or a change in your medication managed by your doctor. The key is to be proactive. You deserve to sleep soundly through the night. You deserve to wake up feeling comfortable and refreshed. You deserve to enjoy your food, to speak with ease, and to have a healthy smile. Don't just accept dry mouth as an inevitable part of life. Take these steps, talk to your healthcare providers, and reclaim your comfort. Thank you for spending this time with me today. Be well and sleep well.